but the weekly trend is on a decrease.
Friends heading overseas recently asked mathematical epidemiologist Chapin Korosek whether it was medically safe for their young family to travel to a certain part of Europe amidst a measles outbreak. He crunched the numbers and sent them a one-page outline with the most current disease outlook, and then he started thinking.
Maybe a lot of people would like this hyper-local, active information for disease trends in their region, and then that was the spark that led to this idea.
6 months later, countless hours, and $3,000 later, Korosek, his wife Alexandra Casper, and Michael Daly, all from Goderich, launched episense.ca, a web-based app that essentially is a weather app for illness tracking, allowing people to see what the disease trends are in their specific area of the province.
We saw a lot of this during the COVID outbreak. There's lots of information available, but it's not easy to digest or understand as an everyday person. So with episense.ca, what we're trying to do is make that information accessible and easy to digest, just like a weather forecast.
You don't want to get sucked into deep analysis. You don't want to get sucked into reading 10 different sources. So the vision is really, you can wake up, you can check your episense.ca app and just see what is the real risk out there.
Right now, episense.ca is tracking measles, COVID, RSV, influenza A and B, and rhinovirus. Users input the first 3 letters of their postal code and they get a dashboard with the current status of those illnesses and which way those illnesses are trending. A Lyme disease tick tracker is under development, as well as an Ontario map with hotspots. Korosek says they're using largely public health data along with a self-reporting tool to try and have the most accurate and understandable health data available to their users.
If we can capture really severe epidemiological trends as they're happening and even get a few days lead time countrywide, then that would be a really valuable thing for society.
Well, the current focus of Episense is tracking health data in Ontario. The next goal would be moving on to BC and possibly across the country.
It's a solution designed by Canadians for Canadians to make them help make better decisions about their health.
It's really to be that disease decision-making tool so that you can keep your family safe.
In Goderich, Scott Miller, CTV News.